welcome and thank you for taking an hour out of your day to be with us. I'm, as you know, Dr. Carol Geffner. I'm the director of the Executive Master of Leadership Program and professor of practice at the Saul Price School of Public Policy. It's great to have you. I'm going to introduce our panelists today, and without any further delay, I'd like to introduce Ms. Andrea Welsing, who is the director of the Office of Violence Prevention at Los Angeles County Department of Public Health, Dr. Michael Craw, who is a police psychologist at Los Angeles Police Department, LAPD, and Dr. Jonathan Goldfinger, CEO of Didi Hirsch Mental Health Services. Welcome to our panelists. And because we have such a short period of time, I'm going to jump right in. We will leave some time on the back end for Q&A. And as you have questions, please, feel free to add them in the chat box and we'll see what we can do. As I was researching today, it was actually quite interesting to me that the research on the connection between community health, public health, and law enforcement goes back to the late 1970s. And yet, while researchers and some policymakers have been focusing on this relationship, for the public, largely the domains of law enforcement, policing, public health, mental health have been distinct. Within the past year, given the increased focus on law enforcement budgets and reallocation of funds from police budgets to extended services such as public health and mental health, now this conversation is in the public domain. So I'd like to start off with a broad question that actually might help our listeners today get a deeper sense of this connection. And I'm going to ask each of the panelists to talk about this. What is the relationship between community health, public safety, and policing? And Andrea, I'd like to start with you.
Thank you for the invitation to be here, and pleased to be on this panel with Dr. Goldfinger and Dr. Craw. I think that what you say, to me, the connection between policing, community health, and public safety, they are very interconnected. And I think for me, I look at it in part from this lens of the disproportionality in policing in vulnerable communities has a number of health impacts. And so in addition to health issues, in addition to deaths, that as legal intervention deaths, which is what we call it, we participate in a national violent death reporting system. We look at every violent death in LA County, and we look at homicide, suicide, legal intervention deaths, and those who are unknown cause. But in addition to the deaths that when policing is lethal, it can lead to a number of adverse health outcomes, including physical injuries, psychological trauma, wrongful convictions, loss of employment, and family division and separation. So all of these significant psychological, economic, social, and health difficulties are devastating and can have actually multi-generational effects on individuals, families, and communities.
Thank you. That's very, very helpful as a first foray into the conversation. John, would you add to that, to the picture?
Sure. So thank you for having me, Carol, and thank you to USC and all the esteemed partners that brought us all together here to have this very important and exciting conversation. In many ways, as Andrea was saying, and as the research you found reflected, the research is actually really catching up to what we already know as a society. So I'll give you an example. As a pediatrician who researches childhood trauma, we know that adverse experiences for kids and teens literally gets under their skin, affects how their DNA is read and turned into their organs, can actually affect the developing brain and body. And when you're young and you have perhaps a parent who's incarcerated or have had a scary experience or scary run-in, perhaps with law enforcement, or even sadly, as we see too often today, watch someone on video being murdered who looks like you. That can be very traumatic. And the theme, if you will, is that these are intergenerational traumas. These are things that are affecting both the youth of today based on what they're seeing in their parents and in others like them. And it's passed down, and it actually affects entire families and communities. And so the work I know we're here to talk about today, the advances we're making, are really able to help children, families, and communities thrive by breaking those cycles of intergenerational trauma.
Thank you. And Michael, what are your thoughts?
To kind of round out the conversation, our police psychologists, what we see on a daily basis when officers come in for psychotherapy and debriefing is the impact on their psyche due to exposure to crime victims, because they're the first responder, the first folks to get on the scene of a homicide or other violent tragedy, including car crashes. And so they're witnessing human misery and suffering day in and day out when they respond to those radio calls, when they respond to calls for service, when citizens call them for help. And so our job, I'd like to think that if there's a way that exposure to human misery and suffering and just the things that officers witness and experience, we have tried to figure out a way to mitigate the psychological impact of that, because for a healthy community, they need healthy police officers. And so our job is to provide the psychological services. And we boast very enviable numbers in terms of prevention of police officer suicide and other problems compared to other agencies. With our embedded model of having psychologists assigned to the various police stations that are there and available, and really put a human face to psychology. And we're very successful at encouraging our officers to seek out help, and we're preventing a lot of problems in their lives.
So that's a great segue to another question. You're talking about the impact on police officers as they deal mano a mano with tragedy and trauma. John, you've talked about the impact on communities, and Andrea, you were referencing also the relationship between law enforcement and public health. So while we know of the connection, this relationship, and while individuals who have been impacted and families who have been impacted know about the relationship, what are you doing to help bridge the divide with your internal stakeholders? So in other words, with other law enforcement, members of law enforcement, maybe members of the police department who have not been individually impacted, your employees, et cetera. So all of your internal stakeholders who may not necessarily understand the connection between policing and health, as well as the external stakeholders in the community. What can you do and what are you doing to help bridge the divide so that people understand there is a link between law enforcement and mental health and public health? And let's start with you, John, this time.
So, I'm a firm believer in leading by example. I think we spend too much time trying to blame and shame individuals, and we have a saying in early childhood and childhood trauma field, which is we need to stop asking people, and our law enforcement, our professionals in healthcare and mental health services and in public health are human beings. So the same statement applies. We have to stop asking, what are you doing or what have you done? And ask, what happened to you? We call that a trauma-informed approach. And it's really important to remind ourselves that we are all human, even if we're trained to be heroes or behave in certain tense situations, we can all make mistakes. And we have to acknowledge that, and we have to think about the systems and what they've done to us, as well as how poorly they are designed in many instances to serve our communities and public health and public safety. And I think when I say lead by example, we have to use what is often the most important, but I would say underutilized form of adult learning, which is trying something different, actually doing something different. And that's what we're doing in partnering with the LAPD, so that my staff are learning this by doing, alongside the officers at the LAPD, learning by doing, and those who are in the call centers at the LAPD 911 call center, the operators, are learning that there's a different way. So we have to train our staff, but we have to give them something else to do that acknowledges there are better ways to collaborate and ally for public health and public safety.
So let me piggyback on that, and Michael, ask you, as you know, you work with so many police, what is LAPD doing and what can be done to bridge this divide so that the mass, en masse police officers understand that these issues are largely health issues?
Well, I think our officers come to the table at the beginning of their careers with that understanding. If you look at the motivation behind why police officers want to become police officers, the vast majority of them will say it's to make a difference and to help people. So that's the baseline that they start with. And the screening process to become a police officer is extremely elaborate. And they go through hundreds of candidates just to find one that qualifies based on a number of factors, including their background and their psychological health. So they are the most screened professionals in our society, arguably. And then I can speak from the beginning of my career, which began in April of 2001. So coming up on 20 years, our department has been a leader in teaching our officers de-escalation strategies, partnering police officers with a social worker in the Black and White, our SMART team from MEU, which is a program that we have had in place for more than a decade, so that our officers understand that when the radio call involves a person with mental illness, that a team approach and that collaboration is really critical. Our community safety partnership program is all about forming relationships with the community and putting those officers in those areas in regular clothing, not even uniforms, just to connect with those folks. So there's just a number of ways that I think our department is leading the way in forming this partnership with the community. And I think our officers from the start really understand that, and it's their emphasis. It's what they want to be involved in. And then at the same time, we worry about certain units that have been decreased because of defunding. I can tell you that we have something called Internet Crimes Against Children. The amount of child pornography crime-related issues in the city is unsurmountable with the resources that we're putting in that right now, including our abused children section, other entities that we've had to pull from to just basically staff basic patrol. And so we worry about other specialized units like human trafficking, which is a huge problem in this city. So there's a lot of challenges. And from our perspective, we're more than willing to engage in that community-based partnership. And I think it's been that way since I've been a member of the department.
So LAPD, as those of us on the panel know, has taken really a leading role over the years in many of these areas. As a department, very forward thinking. And as you say, some of these approaches have been embedded for 20 years. Let me turn the focus a little bit to public health. So Andrea, can you talk a little bit about what can the Office of Violence Prevention do to help diminish the tension between community safety and policing, and what can the office do to further build upon these collaborations?
Yeah, so I want to start by saying, the fact of the matter is no one department can do this alone. It really has to be a collective effort across multiple sectors. And certainly we cannot do this outside of law enforcement without having, working together. And so I really want to start by saying that I think the Board of Supervisors, LA County Board of Supervisors, established the Office of Violence Prevention to create a more coordinated approach to violence prevention and to promote healing within communities. And so I think we have 6 priority areas over the next 3 years. I think a lot of them support this idea of alleviating the tension, some of the tensions that we see between community and law enforcement. We are really looking to build place-based work through regional coalitions that are involve multiple disciplines at the table, hospitals and healthcare at the table, along with community members, partners, advocates, leaders. We really want to expand our trauma prevention initiative, which looks at intervention strategies like hospital-based violence intervention and street intervention, which the city has as well as a way of sort of weaving together some alternatives, ways of trying to intervene when violence occurs in community. It really acknowledge, and we are part of the work group that is led by the Department of Mental Health and Alternatives to Incarceration that is building this alternate crisis response model. And so I think that really truly holds a lot of promise. I know, John, you're also a part of that, as well as LAPD and LA Sheriff. So I think we're at this place in LA County where we are moving in this direction. It really is about relationships. And I think it's really about how do we work together for that whole care first. And like I think maybe it was John who said, instead of asking law enforcement to respond to a plethora of issues, whether they be mental health or substance use, and is really what are the partnerships, as you referred to, Michael, in terms of pairing either social service agencies with a law enforcement partner or credible messengers with those teams. So I think there's a lot of work that we're doing. We're at the table with many others in terms of trying to really transform our systems and services in LA to be really a care first system. But I really do think it's about relationships. And then the last thing I will say, though, I think in order for us to really move forward, we are going to have to, this is a moment, and obviously in the media, and there's these portrayals, there's this tension. We have to talk about that. We have to acknowledge that. We have to have communication and transparency. And I think we have to acknowledge why community is feeling, a certain way. And then I think together we move forward with solutions, not siloed out or having separate, but really doing the hard work of transforming the way we work together and operate in LA County for the well-being of all individuals within the county.
What I'm hearing is, and what I'm learning, is that there are significant collaborative efforts underway. Again, many of them have been underway for a long time. some are emerging. That being said, what I'd like to do is take a look at how this transformation can be sustainable through systemic change. So we know that all of you are engaged in focusing on the significant community health issues and public safety issues together. And we know that in the public discourse, when there is a tragedy, and unfortunately, once again, this week, we are all witness to yet another tragic circumstance and shooting. When there's a tragedy, the focus, oftentimes in the media, tends to be more along the lines of certain people have to change. So an individual has to change his or her behavior. If only someone didn't act like this. And while that's true, we also know that long-term change, sustainable change, happens as a result of policy changes, practice changes, and systemic change, strategic change. So let's take a look at what you think needs to be done, not just what is being done, but what needs to be done at the policy level and the systemic level to build long-term change and transformation. And John, may I start with you, please?
Good thing. So first I can start at the policy level. For those watching right now, there is a bill, AB 988, in the California legislature, and every state has some version of this because the federal government had passed a law under the previous administration to create a national 3-digit number as an alternative to 911 called 988. It's coming nationwide, July 2022. And in every state, the legislature and policymakers are looking at this, as well as Congress continues to look at this to see how the federal government can support it. So as informed citizens who want the type of collaboration, systemic, the way we're describing, we really need to look at what are policymakers trying to put into law that can support these things, that can fund these things. The bottom line is money talks, right? And a lot of policy is about money. It's about where do you put the money? And as was noted, when we have calls for, divest from police based on individuals, but not really addressing systems, that's not addressing some of the downside of it. Really, we should be calling to divert certain situations from police that they are not trained to focus on. That's not their area of expertise, mental health. Their area of expertise is keeping the public safe, physically safe. My area of expertise, or Didi Hirsch expertise, is keeping people safe mentally, emotionally, and preventing suicide. So that's why we have to come together. So in the policy realm, we have to look at the bills on the table. There's a lot, big proliferation given the awareness of mental health challenges during COVID. And we have to support those bills in California. Please support AB 988. That can help to fund the infrastructure where the pilot we have today, where we are actually fielding at Didi Hirsch, calls transferred from the LAPD, where there's non-imminent risk, no violence. We need these things 24/7. Right now, we only have funding for 8 hours a day. So we have to support policies that put our government and our tax dollars money toward these types of collaborations and allied professional behaviors. And then systemically, again, I can't overemphasize how important it is for us to come together, as Andrea said, and act. What the public is often saying, as I hear it, is we keep saying this is a problem, but are we acting? And I want the public to know that we are acting. We are trying. We are trying to keep officers. In fact, interestingly, the LAPD pilot we have going on today that just launched in February, over 5 years ago, an officer, now a captain of the LAPD, said, "What if we never arrive?" Why did it take 5 years to get it off the ground and funded? This is a policy question. It was not LAPD or Didi Hirsch saying we shouldn't do it. We've been developing this pilot for 5 years, but it took us till February. George Floyd was murdered, and now we could get it funded. So we really have to look at our policymakers and look at our systems and say, are we funding the types of collaboration? And then once they're piloted and we're showing very promising results, how do we make this the norm systematically, where those collaborations ensure that everyone in our community accesses immediately, like we're doing today on the crisis lines with LAPD, with 911 and 988 working together, people access what and who they need in a timely manner, and not others who may not necessarily help, but in ways that could potentially escalate when it's kind of the wrong person showing up.
So let me drill down a little bit on this AB 988 before we continue with the conversation around policy changes and systemic changes. Are you saying that this new number that's coming in July 2022 will centralize some form of dispatch so that if there's a crisis in the community, there are multiple agencies that receive the call? Is that the effect or the impact of this legislation?
Yes, the federal legislation is intended to create that simple number similar to 911. You call and they may dispatch an officer if it's a public safety emergency, or even an individual on a bridge, right? Or if it's a person having a heart attack, they deploy medical professionals, EMTs in the field, right? The ambulance comes. So same thing for mental health. This is saying we can determine on the line. And what's interesting is actually at Didi Hirsch, which is the oldest and most comprehensive suicide prevention center in the nation. And we cover nearly double all the crisis and suicide prevention calls in California, calls, chats, even texts. We have shown that about 96% of the time, we can de-escalate the caller and no one has to be deployed. Not an officer, not a mental health professional, not a child safety or welfare professional. So very important to understand appropriately designed systems through collaboration like we're doing are going to create the opportunities for highly efficient systems. Whereas right now we have that fragmentation. And that's the work that also Andrea was describing in Los Angeles County, where the Board of Supervisors motion, that's their policy, to say that all of our agencies must come together under the leadership of the Department of Mental Health. And we have all of the call centers, including the Department of Child and Family Services, the domestic violence hotlines, the suicide prevention lifeline, which is us, LAPD, Sheriff's Department, everyone, fire, coming together and saying, how do we coordinate to make sure the right person is on the line and when needed shows up?
So that's a great example of what's being done. And to your point, a crisis certain crises tend to fuel kind of a sharpened focus on policy developments and systemic developments. And so, Andrea, before we move on from this topic, is there anything else you want to say about what you would like to see done or efforts that are underway that we don't know about that will further strengthen these collaborations?
Yes, just a few things. I want to piggyback on what John was saying. And one, I appreciate, Carol, that you called out, because our dominant narrative is focused on individual behaviors rather than policy systems and practices. And usually where violence is concerned, you have to look at the context in which it occurs. So I think when I think about systems change and policy practice and systems change, I think there's a lot that needs to be done. I think the alternatives to crisis response, the new 988 number and the work that's being done there is really important. But I would emphasize that, from a public health perspective, we have this public health fable narrative, and it, where someone is a fisher person is on the bank of the river and fishing, and someone comes along, they're drowning. John's smiling because he knows this story. And he pulls the person out of the river, patches them up, takes care of them, goes back to fishing. Another person comes down. And pretty soon, more and more people, and there's just not, and you're pulling them out. Public health really, I think, an important point that we can make and where we focus is stopping the pulling out of the bodies from the river and look upstream. Why are they falling in the river in the first place? What are the conditions, whether it's poverty, racism, lack of access to education, lack of access to jobs? How do we go more upstream? So I would challenge us as a county, as we're doing this really important work across multiple sectors, is, you have upfront, in the thick of it, and in the aftermath is one way I've heard it described. I think we need to shift more and more to this upfront, upstream approach of what can we look at, what policies, practices, and systems change do we need to do really upstream to help families. Like when babies are born, we have a maternal, child, and adolescent health program that sends nurses to families' homes. Like, how do we invest in families really early on? How do we invest in our youth so that they have access to the services, so that we don't have to necessarily have the need for further downstream when it's way too late to intervene or to do suppression or enforcement? Like, how do we go more upstream? So not to say those things aren't necessary, but how do we go more upstream? The last thing that I want to say is a really important point that I think Michael brought up is vicarious trauma. So, and that is for across the board. It's law enforcement, but everyone doing, violence prevention work in the community as well. We need to build a better system around resources and support for those who are responding to violence in the hospitals. And so I'd love to see us look at how do we build that into our work in so that it's really embedded. There's a lot of talk about trauma and trauma-informed care and practice. I think it means a lot of different things to a lot of different people, but I think we need to systematically look at how we make that the default, is that our services are accessible and they are trauma informed. Those who are responding, whether it's physicians, law enforcement, fire, community-based organizations, interventionists, how do they get the access to the resources that they need, as to that they do not further re-traumatize because they are experiencing trauma.
I'd like to pick up on this notion of vicarious trauma. And I'd like to turn this, Michael, right to you, because you deal with this every day in terms of the trauma that police officers are experiencing, not only when there's been a tragic incident, but when they are regularly out in the street and dealing with these very, very difficult issues all the time. And I must say that I have many students who are in law enforcement and hear the difficulties that they go through just in their everyday work. So, Michael, is there anything you want to say about, what can be done within law enforcement, and what are you doing that's making a difference and really helping police officers with their vicarious trauma and the effects of trauma that they're facing every day?
Well, I think they're experiencing direct exposure to trauma in their day-to-day work, and our civilian workforce, including our police psychologists and other folks, are the ones hearing about this in detail and vicariously traumatized. So we have a number of initiatives. We have a resiliency task force where we talk about programs. We have seminars, webinars that we do trainings on this topic. Our civilian employees are eligible to come for psychotherapy as well as the police officers, so we don't make that distinction. Also, the significant others, married or not, of our department employees, mostly our police officers, are eligible for services because our officers are going home to a family system. And one of the tragedies that we saw in the wake of the killing of George Floyd and the protests was all this negative animus toward law enforcement. And we used to say to our officers in roll call and other settings, you know, it's helpful to have friends outside of law enforcement because you may be getting a skewed view of reality. We don't say that anymore because a lot of our officers whose friends are not in law enforcement turned on them and bunched them in with some of these other situations like in Minnesota that had nothing to do with the LAPD. And we've had officers' children bullied on social media because of the negative sentiment about law enforcement. So we had to dig deep and figure out how to help a wider range of our employees and their families because of what was happening. And so we have just a number of programs. We actually partnered with the USC School of Social Work to get telehealth services for the children and elderly parents of our employees and officers because they weren't eligible for our services. And there's a limit to how much we can do with only 15 psychologists, even though we're one of the largest police psychology entities in the nation. We have a peer support program of over 350 sworn and civilian members that help out our officers, as well as a chaplaincy program. So at every turn, we are looking for creative ways to help our officers be healthy so that they can do this job under very difficult circumstances currently. And I have not seen morale this low since I've worked here, where the police officers feel like they have been abandoned by folks that should be supporting them in their efforts.
I'm really glad you are mentioning that because the negative animus is it's ubiquitous around the nation, and we hear it in Los Angeles quite a bit. And as we all know, you know, the healer needs to be healed, right? We can't deal with public health issues and mental health issues and ask someone to do that if they are not receiving the care that they need to actually, you know, be effective in their jobs. Let's take a look at the role of the community. We've been talking about the role of the public health, mental health, and policing. Is there a role that the community plays in improving this relationship between policing, mental health, public health? We don't talk about this very much, and but if ever there was a group of people to address this, it would be you. So is there a role, and what is it?
I can jump in, and I think it's tied to what everyone is saying. What people don't realize about trauma, the way it's passed down from generation to generation is not just in our behavior. It's actually baked into our DNA. So people should realize there is no culture or society that never had a war. There is no culture that didn't experience at some point in history famine or violence or animus. And if we choose to take negativity, ill feelings, and we vent them outward toward the other human on the other side, no matter which side you think you're on, you're just perpetuating that. And I think I would ask our community members, just like I ask our mental health professionals and our officers and people in public policy, especially people who have megaphones on Twitter, right? To tone it down. They don't realize, you know, that the negativity that you're saying about another person, you know, that old adage, sticks and stones may break my bones, but words will never hurt me, is absolutely scientifically incorrect. Negative things you say affect you and the people who listen to them. In your DNA, it is changing your organs today, and that of your future offspring and your family and your community. So I would encourage everyone to kind of listen to what I think, I'll read it because I was looking for it, a very powerful quote from Dr. King, which was that nonviolence is a powerful and just weapon which cuts without wounding and ennobles the man and women and people who identify otherwise, to modernize it, right, who wields it. It is a sword that heals. So when we go out and advocate, when we go out and we have to decry tragic incidents and systems that discriminate, and we have to be nonviolent and tolerant and kind even to the other as members of the community and as professionals. Because if we don't, we're just continuing what humanity has known for a long time, that nobody wins with violence. It's self-perpetuating.
I think that that is a beautiful and important message to land on as we open up today the questions to those who are listening. I think your message about kindness and the importance of recognizing the humanity of the other is it's crucial in our healing and in improving our health at the individual level and our well-being at the individual level. So I'd like to address some of the questions that have come in, and I'm not going to screen them, so I'm just going to read them as is. Police officers have a psychological assessment when they're going through recruitment. What do you think about police officers repeating this assessment and evaluation at 5 or 7 year intervals to check on their psychological health as they continue their careers?
Those efforts are underway. It's a national push. There are some smaller agencies that have already started that. We have a proposal in place right now for biannual wellness check-ins, so every 2 years. And it would be primarily with our officers in what we call operations, so officers that are working in a patrol function who have the most exposure to stress and trauma. We think that it's been an inspired idea for many years, but there were some legal changes recently and some case laws that make it more able to be implemented without challenge. And I think that we'll have that program up and running probably within the next year or so.
So that's really great to hear. And I think, there are some folks who would say, how can we increase the frequency because of the continuous animus against police and the violence that they see every single day. So let me go to another question. Thank you, Michael, for that. In Reseda, California, there was a mother who allegedly killed her children and was then accused of paranoia, mental instability during a custody fight. Is there any kind of a local checklist in which there is a kind of shared information with public servants? Is there a local checklist in which is shared with public servants in general to be aware of the systems in place to better support the victims? So I think the question here is there anything that public servants can access in terms of data? In this case, the question is about checklists to be more cognizant of the systems that are in place to support the victims in these tragic circumstances. So John, do you have anything, or let me open it up to not put you under the spotlight. Is there any of you can answer? So let me pull back, John, and just see who would like to address the question.
I can start. The answer is there's no, sadly yet, universally accepted checklist of resources for trauma or exposure to violence or loss or grief. These are all kind of right now in different silos, fragmented. Your primary care professional should be able to, which is arguably one of the public servants most of us see the most frequently, and your child's teacher for kids, that's one of them who you'd see very frequently. These people should be able to monitor, and we're working on it, the mental health and well-being of those who've been exposed to adversity, including violence, and should be able to refer to the appropriate resource in the community. But there's a lot of work being done. For example, the state of California, we have an initiative under our first Surgeon General ever, Dr. Nadine Burke-Harris, called ACEs Aware, where we are identifying trauma, which does include law enforcement or incarceration involvement in a family. We are identifying trauma in predominantly low-income children and adults in their communities, and helping primary care professionals identify that and then connect to the right resource. But those resource lists and checklists are actually being built, and they're different in every location. So the appropriate resource for support may differ, may look different, and may have, as we know from the pandemic, different levels of availability depending on your zip code, where you live. So there's a lot of work to be done to pull those resources together, but we are doing it. And similar to the previous discussion, we're bringing those resources and those people, those professionals in the community to the table to say, it's not just primary care, it's not just mental health care, it's not just law enforcement, it's all of us that serve human beings need to know the rest of us and need to know how to get you where you're going. And there's a lot of also policy and payment reform getting behind this type of what we call maybe enhanced care management or system navigation support.
It's really important for the listeners, our audience, to know that these efforts are underway. And, as most of us know, while transformative change happens at the systemic level and the policy level, we have to do what we can incrementally, right? Community by community. So while everyone is hungry for impactful solutions, unfortunately and realistically, these kinds of very complex improvements take time, and more time than any of us would ever want. Let me go to another question just for the sake of time so we can address what's coming in. Here's one that Michael goes right to you. And the question is, how do we change a warrior culture in policing to move towards more of a guardian concept so that people can learn how to de-escalate incidents?
Well, I think an assumption is being made that there's a current warrior culture, because that is not the mindset of our police officers. They are coming to the table now as recruits and seasoned folks for many years with the idea of guardian protector. They are crime-centered folks, very focused on victims and preventing crimes. That's what they're about. And I think it's just another example of how the community sometimes doesn't understand the mindset of our officers, and that creates more of that schism because we haven't had those conversations about what police officers are really like. So any opportunity that our officers have to interact with members of the community, I think that most community members walk away from those interactions with a newfound respect and hope for the future of what our police officers are really like as human beings. And I'm proud that there are so many opportunities for those interactions and initiatives and programs to make sure that people appreciate and understand what the mindset is of our folks.
So I think this question also gets to the role of the media. And while our audience is not largely comprised of members of the media, let's just take a moment and talk about this. You know, is there a role for journalists and broadcast journalists to help or to support the movement upstream? Andrea, using your term, is there a role for the media? What would you want to say to members of the media around how they can help this narrative, shape the narrative? Who would like to respond to that first? Andrea.
I'd like to respond because I've been wanting to jump in a little bit, across some of these questions, but so first of all, I mean, in terms of the media question overall, I would just say, media does shape. It comes into our homes, it comes into our businesses. We're constantly connected to the phone, constantly exposed. And so I think media plays a huge role, and especially too for our young people who are so linked into social media in different forms. So I think there's a huge role, like what's focused on. And, for example, mass shootings traditionally get a lot of media attention and not the day-to-day violence that is occurring in some communities. And I also think the way in which that violence is portrayed, how it's looked at, there's a lot that I think could be improved there in terms of how the story of violence or how the issue of violence is portrayed in social media, and to do it in such a way to also open the door to say that violence is preventable. Like the way that it's portrayed so often is that it's an inevitable part of human nature, when we know that there are things that we could do to prevent violence in the first place. The other piece I'm going to try to slip in here is because it's about journalism, but it's about this whole conversation about animus and being kind. And I think that's true, but I think this moment that we're in, I just want to say, I think is so reflective of years and years and years of racism and discrimination. I have been part of community groups now. In the public health department, we have a violence and racism work group, and the stories that and in redefining policing, a report done by Human Relations Commission, great report, would strongly encourage people to look at that, redefining policing. They did 7 listening sessions, including the last one with law enforcement professionals, and then one with LGBTQ populations and women of color. There's deep wounds. There are deep wounds. And I am going to tell you, in terms of the data, who is most impacted are people of color. It is there across every health indicator in terms of incarceration. Black and brown you cannot tell me that Black and brown people are just inordinately violent, more so than any other group. There is racism and discrimination. There's profiling there, and we have to put that on the table and talk about it. Otherwise, we will never heal. We will never get to a better place. So I just, I think there's a lot of promise in how we're moving forward, but I think before we can get to a place, we have to center the voice of those who've been most impacted by violence and racism, and we have to let that sit there for a minute to help inform what we know about people's experiences in order to then transform our systems. So journalism is a piece of it, but I just think we're in this moment, and I don't think we're in this moment, just out of the blue. It's just really years of experiences that people have had that want to say no more. And I think that's important to hear.
So Andrea, I want to thank you for putting this so articulately on the table, all of us here today on the panel spend our lives dealing with human behavior. And so we all know that if a person doesn't look in the mirror first, if the tendency is always to shine a light on the other, change doesn't happen. So fundamentally at the individual level and at the systemic level, we all know that we have to look in and say, and when I say we, I mean each one of us here, all the systems, all the leaders of the systems have to say, what are we doing that is contributing to this? And without doing that, it just becomes too easy to point a finger and say, well, it's the other organization or it's the other person who needs to change. And I think this is likely the best time in our conversation to ask each of you what you would like to say as a closing remark. What do you want to tell people who are listening today about how to improve community health, public safety, and policing? What do you want the takeaway to be?
I'll start. I think it's about making sure that law enforcement is at the table in some of these policy discussions. And our officers have tremendous insights on crime causation and what can be done to decrease the number of crime victims out there. And their insights are important to be included.
Thank you. Andrea.
I guess I would just say that as we do this transformative work in LA County, we do need to do this work together. I don't think it's going to be easy, and I think it might be a little bit uncomfortable for a minute, but it's the only way that we can move forward. I think we need to bring community to the table, first of all, and we do need to really look at internally at government systems too that have perpetrated harm, as well as and not just point fingers, but we do all have to do that hard work before we get to the transformation. And we have to make sure that as we do that, we invite people who are most impacted to the table as well.
Thank you. And John?
Completely agree with what everyone is saying. And I would just add that trauma is not destiny. No matter what side you are on or how you feel, it does keep us angry. That is true. But because the mind and body are really inseparable, there's no such thing as a mind over here and a heart disease over there. Depression, people who die of heart disease, inextricably linked. The science is clear. So we have to remember that mental health is health. And in order to be advancing progress, think about our own trauma of whatever system we are a part of. What did it do to us? Think about what did it do to the other person involved, their system. I speak to myself a little bit. Doctors have some of the highest rates of suicide in America. Why is that? Because our training traumatizes our young and our trainees. And so we need to look inside ourselves. And because the mind and body are connected, understand that the way to address trauma from perpetuating starts with us. And there are ways to do it that we already know. Eating healthy, exercise, nutrition, things like that. Having healthy, safe, stable, nurturing relationships with anyone in our own lives heals the damage of trauma on our minds and our bodies. And if we take it upon ourselves to think of our mental health as health, to heal ourselves, and to deploy some more nuanced things like mindfulness meditation, and yes, demand access to mental health care, get our head checked with all the trauma we've lived through. If we can do that, then we will be the right people for society to heal a lot of these wounds.
I wish we had more time to continue talking about this. I want to say to those who are listening today, I want to thank you for being here. I hope the conversation today has highlighted some of the good work that's being done across the region And I hope we all take our effort and our energy and our intention forward to continue helping our communities heal. And with that, I would like to say thank you and wish you all good health and peace.